Hi, everyone. This is Christian from Great Health. I want to talk today about what to expect with your first chemo treatment. So, what to expect, things that will be likely happening, some side effects to look out for, and more. And this all comes from a Great Health perspective. So patients and caregivers that have gone through this that can give our unique experience that can hopefully help out everyone else so they get an idea of what to expect. So, first, know that when it comes to your chemotherapy infusion, it could take minutes to multiples of hours, upwards to almost a full day. It kind of depends on the chemotherapy that's being administered and the regimen you're on, etc. But know that you can be expected to be in the infusion room for quite some time. And that takes me to the second point, which is you're going to be having your chemotherapy administered likely in a chemo and infusion therapy room. Now, these areas are kept really clean. These are rooms where really only patients that are getting infusions should be in. They're usually pretty quiet. So just expect that you'll kind of be off a little bit by yourself, but with others around you that are also receiving their chemotherapy. So expect a lot of downtime. So like I said, your chemotherapy can take minutes up to multiples of hours. So asking some of the team members on the team, there was a whole bunch of different responses about how we all spent our downtime. So some of us read some books, some of us played some games on, a handheld gaming console. Others did things like knitting. So just some kind of stationary things. You can listen to podcasts, you can watch videos, watch movies, probably bring some headphones just for that. And yes, you can even nap. So that's something that you should be talking to your oncology nurse about just to make sure it's okay. But that is something that some folks on the team did, as well as saw others do when we were getting our chemotherapy, when we were cancer patients and receiving that therapy. You can also walk around. So I know personally, I was able to walk around with just having the IV bag on a pole. Had to go to the bathroom. That's something you can do during some chemotherapy infusions, etc. You don't want to walk around like laps around that therapy room. But if you need to get up to maybe grab a bite to eat or get some water, it's definitely something that you can do as well. So when it comes to the actual infusion itself, and obviously you're going to have some chemotherapy drugs based on, again, what your cancer type is, what your oncologist prescribed, etc. But likely before you actually get infused with those medicines, you're going to get some pre-medications or some pre-meds. And these are to help you in terms of things like pain, helping combat nausea, and even combating anxiety. And a couple of things that the Great Health team members experienced were, these are really great. These are obviously very helpful. Now, they're not going to curb all those side effects, but they're really meant to help, but also know that they can also cause some side effects themselves. I know personally, I was experiencing some constipation issues, both from the ABVD I was on, as well as some of these pre-meds. So there are some side effects to this, but generally it's a good thing. But no, at least in the very beginning, when you first get there, you're likely going to have some pre-meds infused first, and then the actual chemotherapy drugs after that. Now, does chemo hurt? The answer is not really. It shouldn't be very painful. If it is painful, it's something that you need to tell your oncologist nurse right away. But generally, chemotherapy is not painful. There can sometimes be a little bit of a slight burning sensation. It should be very slight. And if there's anything more, that's something to talk to your oncologist nurse about at that time. But if you're expecting to have any type of pain, there is no pain when it comes to having that chemotherapy infusion happen. The one thing that personally I felt the most was when the saline flushes were happening before we started any of the chemotherapy infusion. And that really gives you a really cold kind of feeling right where I had a PICC line personally, but that's where I had a very cold feeling when that happened and a little bit of a salt taste to my mouth. But, again, does chemotherapy hurt? The answer really is no there. So you should be also on the lookout for side effects. Again, this is based on the chemotherapy infusion cocktail drugs that you will be having. But so some common side effects are things like nausea, headaches. You're going to have, likely a lack of energy. There could be some bone and joint pain depending on what you're receiving, as well as, like I already mentioned, some constipation issues as well. So definitely a lot of side effects. What you can do is you could become a member of the Grit Health community, log into the platform via the web or via our app on the Google app, Google Play Store, or the Apple App Store. And one of the best things about being a member of our community is you can be automatically matched with other folks in the community that have a very similar cancer type as you. So that's where you can start asking those direct questions to those folks and ask those questions such as, hey, I see your cancer type is like mine or a similar age. What kind of chemotherapy did you receive? And what kind of side effects did you have? Because these are going to be very unique based on, again, that cancer type, the kind of chemotherapy drugs you're receiving, etc. But hopefully this video covered some overview topics of what to expect for your first chemotherapy. If you have any questions or comments, please let us know. We're happy to help find some resources as well as direct people around using our community platform to get some of those one-on-one answers as well. And again, this is Christian Bullock from Grit Health, hoping that your first chemotherapy appointment goes smoothly. Definitely let us know in the comments if it has, or if it hasn't. Please let us know. We're happy and we're here to help. Thank you.